It's a little magic tool, for sure.
It took the healing to a completely new level.
That was my salvation.
The body parts may be different, the conditions they battled may be different, but the therapy that helped these 3 individuals find relief came from this one device. What we're talking about is Radial Pulse Shockwave Therapy, a therapy that carries some interesting nicknames.
Some people call it the jackhammer, which is one of my favorites, and some people call it the meat tenderizer, which sounds kind of scary, so we stay away from that name.
Dr. Todd Rodman is a chiropractor who specializes in non-surgical sports medicine. Being a self-proclaimed gadget nerd, Dr. Rodman was first exposed to the Radial Pulse Shockwave Therapy while on staff with the Ironman Triathlon. He was so impressed with the priceless $20,000 device, he wanted to offer it to his patients in his office setting.
I'm always looking for another tool in my toolbox, something that may help a patient as best and as quickly as possible. It reaches muscles deeper than my hands can in a quicker, shorter period of time, and it's very efficient and it's not painful for the patient. It's getting people back to what they love to do in sometimes 2-3 visits as opposed to 10, 20. It has been amazing for my practice.
So amazing that the device is attracting patients from out of the country, drawing them to Dr. Rodman's practice in Boca Raton, Florida.
She's been having neck pain, shoulder pain into both arms.
Migdalia Hernandez was so desperate to find her mother pain relief, she just flew her in from Puerto Rico. She actually found Dr. Todd online.
I was looking for this type of treatment. I went to a blog. I see his name in it, and I click on it and say, boy, he does it to the entire body, so I'm going to give them a call. I spent $1 million just to don't see her crying. It's just, I get emotional.
She did amazing. Smile on her face when she left. She felt a huge relief in pain, which was great subjectively, her telling me she felt better, but objectively measuring, her neck range of motion increased by about 30% in extension, which was painful. And when she did this before, she would get pain into her shoulders. A lot of it was just from working on the muscles around there. And also her arms, her shoulder range of motion improved significantly too, so she was very happy leaving.
Physical therapist David Lippitz from Long Island, New York, has treated more than 200 patients with this innovative device.
The unit has had a tremendous effect on our practice. The first thing, obviously, is it enables a patient to get better sooner and quicker. The second thing is it enables us as therapists to deliver something to the patient that wasn't physically possible prior. Essentially what we were doing prior to this was utilizing our hands to try and manipulate tissue. It's far more effective to utilize a device like the radial shockwave therapy, and it also takes a lot of stress out of us as clinicians. So overall, it's been a win-win for everybody.
Well, I am 73 years old, but inside, in my mind and my body, I feel like a 50-year-old person. And that precisely may be the reason why my chronic pains was so hard for me.
Jaime Piescachon gets emotional just thinking how the radial pulse shockwave therapy gave him his quality of life back. After exhausting 2 back surgeries and even after having a spinal cord pain stimulator implanted into his back, Jaime's life was still crippled by chronic pain.
My 2 main doctors that I visited for my back, my surgeon and the pain management doctor, they had told me, sorry, there is nothing that we can do. This is a chronic pain and you will have to live for the rest of your life. The chronic pain didn't allow me to sit down for more than 15 minutes because the burning was horrible. The chronic pain didn't allow me to lay on my back in bed to read a book. Right now, I can sit longer times with no pain whatsoever. I can lay back on my in bed, read my books. At this point in time, I can say that I have recovered my quality of life, and I am at least 80% better thanks to this treatment.
He's had a lot of failed back surgeries. Even though back surgery can be great, his didn't work out. And the therapies that I was doing, the active release technique, the Graston technique, movement taping, chiropractic adjustments, just weren't quite getting at the root of it. No matter how hard I tried, I couldn't quite get deep enough. If you imagine a muscle being like a rubber band and it stretches and it contracts, now if you imagine putting super glue on a part of that rubber band, that area just won't move very well. So really the problem that plagues today's society is overuse injuries. It's not that major trauma. That's not how things always happen. But that is how we develop these scars on these muscles, and it limits our range of motion. It can adhere to nerves that course through the muscle, and every time you use that muscle, now it's going to pull on that nerve. So a lot of radiating type pain or nerve pain is actually from scar tissue that adheres to a nerve. I've studied a lot of techniques to kind of pinpoint and really try to get that scar tissue out. Graston technique has been great for it at really removing the scar tissue superficially. Active release technique is a little bit deeper, but nothing that I have done so far has been as profound or as significant as shockwave therapy, which really tremendously breaks up scar tissue in the shortest amount of time that I've ever seen before, and also saves my hands.
So in a sense, the radial pulse therapy, which is cleared by the FDA for the treatment of muscle aches and pains and for increasing circulation, is an extension of the practitioner or therapist's hands. Jeff Gebhardt treated patients for many years as an athletic trainer.
You start to develop wear and tear in your hands. You develop maybe arthritis or just other type of conditions, whether it's carpal tunnel or something like that. You abuse your body as a physical therapist, a chiropractor, athletic trainer. Radial shockwave or radial pulse therapy is a good analogy. It's a ballistic shock or a ballistic energy delivered to the tissue, and it's like dropping a rock in a pond. So that at the point of impact you have the most energy, and it has a ripple effect outside of that impact point. Whereas traditionally shockwave is thought of as like for lithotripsy, used to break up kidney stones into the kidney, and it's like taking a rifle and trying to hit a bullseye, which would be the kidney stone. So this is a very generic or very general, more superficial treatment.
I thought, if the Olympic athletes are using this, then, this must be something worth doing.
Marathon runner Gail Valcho credits the radial pulse therapy or radial shockwave for swiftly relieving her Achilles tendon pain in her left leg. Matter of fact, at the age of 48, Gail is right now training for her first triathlon.
I just want to keep doing everything that I love to do as long as I possibly can.
It's mindset.
3, 2, 1, go!
Mindset plays an integral role when it comes to physical performance. Ask Larry Schnurmacher.
One more. Let's go. Come on. Good job, Larry. 5 rounds done, buddy.
At the age of 47, Larry is in the midst of intensive training for an upcoming CrossFit competition. He recently turned to Dr. Todd Rodman and his new radial shockwave device to help ease some pain he was experiencing in his forearms.
Within 2-3 treatments of my forearm, all sorts of minor pain, from picking up a cup to shaving to tucking my shirt in my pants, stopped completely. No more little tweaking pain.
We've had people that were cured really in 1 visit. We've had some people that, it's 10 visits now, and they're 80-90% better, but they like the machine and they want to strive to really get to 100% or as close as they possibly can be to 100%, which may never, honestly be achievable with certain conditions. But they can get 95% and they don't think about their pain anymore, and they're back to their activities of daily living, and they don't have to have that first thought of their day, how bad is this pain going to be today?